Has someone close to you exhibited subtle but worrying changes during the past year? Many believe that death and aging occur abruptly, but in reality, the body often provides quiet warnings months, sometimes even a full year before life's final stage. Unfortunately, most people overlook these indicators because they initially appear insignificant. It's only in retrospect that families realize the signs were present all along, but by then it's too late to prepare or to make those final memories meaningful. In this comprehensive presentation, we'll discuss 5 critical indicators that frequently appear 12 months before an elderly person passes away. Some might be changes you've noticed but dismissed as normal aging. Others may seem minor but actually indicate the body's gradual decline. By learning to recognize these subtle shifts in health and behavior, you can take proactive steps rather than reactive ones when the situation becomes more urgent. Identifying these signs early allows you to provide enhanced care, treasure meaningful moments, and ensure your loved one's final phase of life includes comfort, dignity, and peace. Continue watching until the end, as these 5 signs can help you prepare both emotionally and practically for what's coming. Understanding these changes means you won't be caught unprepared and can maximize your remaining time with those you love. The first significant indicator to watch for is unintentional weight loss. This often begins subtly. Perhaps you notice a belt that needs additional tightening, clothes that suddenly appear looser, or a previously robust appetite that gradually diminishes. Many families mistakenly attribute such changes to the normal aging process, but unexplained weight loss rarely represents a positive development. This weight reduction typically signals that the body is experiencing difficulties absorbing nutrients efficiently. Muscle mass decreases more rapidly than normal, and essential bodily systems begin slowing down. While aging naturally causes some muscle loss, when it occurs too quickly, it indicates deeper physiological changes. The digestive system may be functioning less effectively, or the individual might no longer process protein properly, resulting in accelerated muscle wasting. This strength reduction doesn't merely make movement more challenging, it significantly increases fall risks, compromises immune function, and makes the person more susceptible to various infections. Another contributing factor to weight loss in life's final year involves fundamental changes in appetite. Many elderly individuals experience a diminished sense of hunger compared to earlier years. Their taste perception often decreases, making previously enjoyable foods less appealing. Consequently, they might begin skipping meals or consuming substantially smaller portions at meal times. This isn't simply a preference change, but represents a physiological shift. The body, beginning to recognize its declining state, sends fewer hunger signals to the brain. The consequences include reduced energy levels, diminished physical strength, and a gradual deterioration in overall health status. We must also consider the impact of underlying medical conditions. Weight loss commonly accompanies chronic diseases such as cancer, heart failure, and kidney disease, all of which can progress significantly before more obvious symptoms manifest. Even psychological conditions like depression or cognitive decline can lead to reduced nutritional intake, creating a downward spiral where the body receives inadequate sustenance to maintain itself properly. Some well-meaning families attempt to address this issue by encouraging increased food consumption, offering favorite dishes, or supplementing regular meals with protein-rich beverages. However, if weight continues dropping despite these interventions, it's important to recognize that the problem extends beyond dietary habits. The body may be preparing for a more profound transition. During this stage, pressuring someone to consume large meals may prove counterproductive. Instead, Focusing on comfort foods that require minimal effort to eat and maintaining proper hydration often contributes more effectively to quality of life. If you observe significant unintentional weight loss in an elderly loved one, particularly when accompanied by decreased food intake, increased weakness, or reduced activity levels, it warrants careful attention. This change represents more than a cosmetic concern. It's the body communicating important information about its changing state and potentially signaling the beginning of life's final chapter. By recognizing these early warning signs, families gain precious time to make important decisions, have meaningful conversations, and create lasting memories before more serious symptoms develop. This knowledge empowers you to approach this sensitive time with greater awareness and preparation, ensuring your loved one receives appropriate care and support during their final months. Understanding this message now can help you prepare for what lies ahead with clarity, compassion, and the ability to make every remaining moment meaningful. The second significant indicator is extreme fatigue and weakness. Among the most noticeable changes in the year preceding end of life is a profound, persistent exhaustion that doesn't improve with rest. This isn't merely feeling tired after a busy day. It's an overwhelming weariness that makes even basic tasks seem insurmountable. Getting out of bed becomes difficult. Walking across a room requires significant effort, and previously routine activities like cooking, dressing, or maintaining a conversation become excessively draining. This goes beyond normal aging. It indicates the body conserving its diminishing energy. As organ function gradually declines, the body begins prioritizing essential functions. The heart pumps less efficiently, circulation weakens, and muscles receive reduced oxygen compared to before. This explains why many elderly individuals in their final months experience weakness, unsteadiness, and inability to maintain their previous activity levels. Another contributing factor is metabolic slowdown. While the body normally produces and utilizes energy effectively, during its final phase, this energy gets redirected. Rather than powering movement, the body shifts toward preservation mode. Consequently, someone in decline typically sleeps more, requires extended daytime naps, and struggles to remain awake for long periods. Some may even experience sudden energy crashes, appearing fine one moment and completely exhausted the next. Perhaps the most heartbreaking aspect of this process is fatigue's emotional impact. Many seniors who previously valued their independence become frustrated or embarrassed by their diminished capabilities. They might withdraw from conversations, avoid social gatherings, or abandon hobbies, not from lack of interest but from sheer energy depletion. This often creates an isolation cycle where they eventually stop trying altogether, accelerating their decline. For families, witnessing a loved one transition from active engagement to exhaustion and withdrawal can be devastating. It's tempting to assume they're simply unmotivated or need encouragement to push through. However, forcing activity won't help. What truly matters is recognizing their limitations, allowing necessary rest periods, and making their remaining time as comfortable as possible. When you notice a loved one experiencing persistent, profound fatigue unrelieved by rest, recognize it as evidence of significant bodily transition. This is the time for cherishing conversations, creating peaceful moments, and offering support without expectations. Ultimately, what matters isn't their activity level but ensuring they feel loved, understood, and comfortable. The third indicator involves increased cognitive confusion or withdrawal. As someone approaches life's final stage, notable changes often appear in their thinking, communication, and social interactions. You might notice previously sharp individuals forgetting things more frequently, struggling with conversations, or becoming disoriented in familiar environments. They may repeat themselves, forget names, or lose track of time, even without prior memory issues. These subtle cognitive changes can emerge months or even a full year before death, extending beyond everyday forgetfulness. The brain, like all organs, requires consistent oxygen and nutrient flow to function properly. As circulation weakens and oxygen delivery to the brain diminishes, cognitive function begins deteriorating. The individual may become easily confused, struggle with decision-making, or have difficulty recognizing familiar people and places. Some experience brief moments of clarity followed by sudden confusion episodes, as if their mind alternates between presence and absence. Another significant indicator is emotional withdrawal. Those approaching life's end often lose interest in social engagement. You might notice them speaking less, participating minimally in conversations, or spending extended periods sitting silently. This doesn't reflect diminished care for loved ones. Rather, their brain processes emotions and social interactions differently now. Conversations become exhausting, noisy environments feel overwhelming, and many seniors gradually retreat into their internal world. You may also observe mood and behavior changes. Some individuals become increasingly irritable, anxious, or easily frustrated, while others display unusual calmness, detachment, or indifference toward previously important matters. This isn't merely a personality shift, but often results from the brain adapting to bodily decline. As cognitive function diminishes, emotional expression becomes more difficult, and the person's reactions to situations may change significantly. For family members, this phase can be particularly challenging. Watching someone lose touch with reality or emotionally withdraw often feels like losing them prematurely. Remember that these changes aren't within their control. Rather than attempting to force engagement, the most supportive approach is meeting them where they are, speaking gently, offering reassurance, and understanding that even without visible response, they likely still sense your presence. If you notice a loved one becoming increasingly forgetful, confused, or disengaged, don't ignore these signs. They often indicate the body and mind preparing for their final transition. This period calls for patience, appreciation of quiet moments, and creating an environment that feels secure, familiar, and peaceful. Even when verbal communication fades, love and comfort remain perceivable. The fourth indicator involves frequent infections and slow healing. As the body begins its final decline, a weakened immune system becomes one of the most evident physical signs. Someone who previously rarely fell ill may now seem susceptible to every cold, flu, or minor infection. Previously minor illnesses now require longer recovery periods, and simple wounds like cuts or bruises heal noticeably slower. These changes aren't coincidental but indicate the body's diminished ability to defend and repair itself. A major concern is recurring infections. Pneumonia, urinary tract infections, skin infections, and oral infections become increasingly common as immune function deteriorates. Many families mistake these as isolated incidents, but when they occur frequently or require extended recovery times, they often signal the body's declining ability to fight illness. Even antibiotics that previously worked efficiently may seem less effective, requiring stronger medications, longer treatment courses, or multiple intervention rounds for infections that once would have been minor. This occurs because slowing circulation and declining organ function reduce the body's treatment response. Another overlooked issue is chronic wounds. When small scratches, sores, or bruises heal improperly or repeatedly reopen, this may indicate compromised circulation. Insufficient blood flow prevents oxygen and nutrients from efficiently reaching skin and tissues, significantly slowing the healing process. Pressure sores become a serious risk for those with limited mobility and can lead to dangerous infections without proper management. Even more concerning is that infections in life's final year often present atypically. Rather than high fever, an elderly person might simply appear unusually tired, more confused, or show decreased appetite. For seniors, sudden mental alertness decline frequently serves as the first infection warning sign, preceding other symptoms. This underscores why early recognition of these changes can significantly impact the comfort and support they receive during life's final stage. For families, witnessing a loved one endure repeated infections can be both frustrating and heartbreaking. The temptation to pursue aggressive treatments remains strong, hoping one additional antibiotic course or hospital stay will resolve the issue. However, at a certain point, priorities often shift from curative to palliative approaches. Ensuring proper hydration, maintaining clean and moisturized skin, and minimizing physical stress can contribute more to their well-being than another medication round that merely prolongs suffering. The fifth significant indicator involves major changes in breathing patterns and circulation. You may notice your loved one breathing more slowly or shallowly than before. Sometimes they might pause between breaths or display irregular breathing patterns, alternating unexpectedly between rapid and slow respirations. Some individuals develop Cheyne-Stokes respiration, a distinctive pattern where breathing alternates between deep, rapid breaths and extended pauses. These changes typically begin subtly but become more pronounced and frequent over time. Weakened circulation represents another common sign. You might observe that their extremities, hands, feet, nose, and ears feel cold to touch. The skin may appear pale, bluish, or mottled, particularly around fingers and toes. This occurs because the body prioritizes blood flow to vital organs while reducing circulation to extremities, clearly indicating diminished cardiac function. Some people experience increased shortness of breath, even with minimal exertion. Simple activities like sitting up, speaking, or changing positions may leave them winded or breathless. You might notice increased mouth breathing or sudden pauses during conversation to catch their breath. If someone previously able to walk across a room easily now struggles with this task, it may indicate declining lung function. In certain cases, pulmonary fluid accumulation can compromise breathing. This may cause persistent coughing, gurgling sounds, or chest tightness. Many misinterpret these symptoms as simple cold congestion, but in elderly individuals approaching life's end, they often signal weakening lungs. This can make lying flat uncomfortable, leading many to prefer sleeping propped up with pillows or in recliners to facilitate breathing. For family members, observing these changes can provoke anxiety. The natural response is wanting to help, encouraging deeper breaths, or worrying about emergency situations. However, in many cases, this simply represents the body's natural slowing process. While these changes may not be reversible, comfort measures can be implemented. Maintaining a cool room environment, using humidifiers, or offering small water sips to alleviate discomfort. In certain situations, medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than attempting to resolve the underlying issue. If you observe these signs, altered breathing patterns, cold extremities, or bluish skin discoloration, pay close attention. These typically indicate the body conserving energy and circulation slowing down. This is a time for presence, offering reassurance and creating a peaceful environment where they feel secure and comfortable. During these final months or weeks, the most valuable gift isn't medical intervention but comfort, dignity, and companionship. As we conclude this discussion, reflect on what we've covered: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 indicators often emerge during the year preceding an elderly person's passing. They may not appear simultaneously or obviously at first, but their presence signals the body preparing for its final transition. For many families, accepting these changes proves challenging. The natural instinct is to resist them, encouraging increased food intake, more movement, or pushing through exhaustion. However, sometimes the most supportive approach involves acknowledging what their body communicates. Rather than focusing on reversing the inevitable, we can prioritize making their remaining time peaceful, comfortable, and meaningful. Understanding these signs isn't about fearing death, but preparing for it. Recognizing these changes early enables better care provision, timely decision-making, and ensuring your loved one's final months include love and dignity. This period calls for cherishing moments, sharing stories, and conveying that they are valued and accompanied. If you're observing these signs in someone close to you, pause and remember you're not facing this journey alone. Many families have navigated this path before, and while never easy, understanding what to expect can foster strength, patience, and peace. Thank you for joining this discussion today. We welcome your feedback. Please share something you learned and how you plan to apply it. Your thoughts matter greatly to us, so don't hesitate to express them. Reading your comments provides tremendous motivation and encouragement. If you found this information helpful, please support our efforts to continue creating informative and inspiring content.